Compassion is a really important thing. There are a lot of people that don't have compassion, and I think if you haven't got compassion, I don't think you can truly understand your patient.
I think death is sometimes a beautiful thing. There's people who are in pain for years. Death is kind of letting them free. I find it empowering for that person.
For us as doctors, to have the luxury of time to sit down with someone is actually really pleasant. Sometimes you're not afforded that. Oftentimes that's the nurse's role.
After someone has passed away, I do love to take the time and wash the body. I do talk to the patient and say, you're at peace now, goodbye. It's just a very special time as a nurse.
I've enjoyed a very diverse nursing career. I worked in Hyde Park in London during the bombings in '74, but my true passion is aged care. I'm Marion Bills. I'm a quality improvement specialist for aged care. My husband Kevin and I have 5 adult children and a daughter-in-law who all work at the Gold Coast University Hospital. Sally and Gemma are registered nurses in the emergency department. Lisa is a registered nurse in cardiology. Lucy is a nurse educator in the emergency department. And our son Sean and his wife Jess are both emergency physicians. I used to work in a large aged care facility in Collaroy on Sydney's northern beaches. Anyway, the kids used to come after school. They'd spend time with the residents and the residents loved them. I think that might have been the beginning of some sort of awareness of healthcare for them and wanting to help. I think that's really where it might have started. Lisa is a very loving person. She's very compassionate. She worked from medicine, surgical as a grad, to working in children's cancer. I can't tell you the respect for her for working in that area. It is absolutely amazing.
I didn't know how I'd cope, and then started the job, fell in love with paediatrics, fell in love with the whole family orientated care that was given to the children and just the resilience they had. Kids are amazing. It made me appreciate that family is everything. So now I'm a cardiology nurse. So the cardiology department at the Gold Coast Hospital is state of the art. We essentially look after patients with heart conditions, from having a heart attack to needing cardiothoracic surgery.
Lucy had really bad eczema and her hands would bleed. When Sean was quite young, he said, "Mummy, I'm going to be a skin doctor and I'm going to make sure her hands get all better."
I think you've got to have a certain personality to work in ED. It's moving fairly quickly, making fairly rapid, educated decisions and you know, all with certain moderate degrees of risk. I like going to work, not just for the work itself, but the colleagues. Bumping into the family is common. They're often in the same area. Usually it's looking after a patient, but sometimes it's having a joke and just trying to, you know, bring some levity into the situation. But it's about trusting your colleagues and your nurses to, you know, let you know if they're worried about a patient. One of the things Mum always did tell me was respect your nurses and be polite, particularly in areas like emergency where are high stress and you've got to trust each other. Patients need team approaches and ED is a team.
Lucy expressed an interest in nursing from about the age of about 16. Her best skills would be her communication. She's been working in emergency for 14, 15 years now.
I think you get a different understanding or a different empathy as you grow as an individual. One of the things that I always teach is that I don't think you should ever try to separate who you are as a person from your job as a nurse. That is the one thing that is so important for families and friends and patients to see, is that we still have human emotion. Put yourself in their shoes. Everyone's version of an emergency is different. You don't know their story, you don't know what's made them get to that point of their life or what's led them there, but always put yourself in their shoes.
In the last couple of years, Gold Coast Health gained magnet status, which is a huge recognition of the work that nurses do, and it's a very rare thing. We've also gained from the Royal Australian College of Surgeons Cat 1 Trauma Centre for our trauma service. We're one of only 4 in Australia.
I don't want our ED to just be a great place to work. I want it to be the best place to work. And that's one of the things that I strive for as an educator. That we're trying to grow into being one of the best facilities in the world. COVID's been really challenging. Gold Coast Health has done an amazing job. The fever clinics and everything is run so well.
I think it was an excellent response by Gold Coast and Queensland in general. People really took it to heart, and I think we were fortunate that we were able to look over at Italy and China and what was starting to blow up in the US, and I think everyone saw that media and responded appropriately.
Health workers are happy to put themselves at risk. It's the unnecessary risk that we really don't appreciate, and I feel like Gold Coast as a whole has done really well listening to the advice of health professionals. I'm very proud to be a healthcare worker.
I love my job.
I love nursing. We are the Bills family.
We are your frontline healthcare workers.
We are Gold Coast.